Hey, Dr. Lindsey and Wendy here. This is an interesting video on a mustache repair using FUE technique. And this guy is a, I don't know, 35-year-old Taiwanese descent fellow that lives in our area that came in with really no whiskers in the central aspect of his mustache near the cupid's bow portion of the cutaneous lip. And he wanted to reconstruct that using scalp hair. Now the trouble with that is that when we get hair for mustaches and beards, typically you want bigger, fatter hairs. Right? Look at me. I've got medium-sized hair up here. These guys are big, fat hairs. Well, Asian guys tend to have finer hairs up here to work with, and he has almost no hair, so we were constrained by the use of his relatively fine donor hair. Second that goes with that is that relatively fine donor hair is easily damaged during FUE removal. So you're kind of playing, you're trying to get these thin hairs, not rip them up using FUE technique and insert them and hope that they grow thick enough for mustache or beard hair. But in any case, this fella came in and here he is all prepped out and ready to go, and we did a couple hundred FUEs. As you guys probably know, even with a small punch, we get a fair number of 2 or even 3 unit FUE grafts. But look at your own beard in the mirror. There aren't 2 and 3 hair beard units. So very carefully we have them dissected into single graft units, right? And then
yes,
we made little tiny holes and inserted them. And then the third issue going with this is that, when we put hair in the scalp, towards the back of the head, it's relatively flat with respect, the hairs are relatively flat with respect to the scalp skin. And as you come forward, they become more obtuse. Here on the face and the eyebrows, I've got some videos to talk about this, the hairs come out really acute, really almost flat with the skin. And so how do you get those holes to lie flat and not twist and pull the hairs up in an unnatural fashion? So those are just a couple of things we have to deal with when we do these scalp, or when we have to do these beard, mustache, and eyebrow transplants.
Yeah.
So here he is at the end of the case, and he looks really quite good, and he did a good job cleaning. He came.
Yes, he came
almost every day.
Almost every day. Yes, for us to clean it. Yeah.
And then, like everybody, he promised he'd be back once a month for me to take pictures. And he just walked in 9 months out. We hadn't seen him since then, and here he is at 9 months. Recall, it takes generally 13 months or so for things to fill in. But he looks good.
He looks good, and it looks natural.
It certainly matches what he already has. Yeah.
Yes, well that helps because he has. I mean, this was peach fuzz.
Yeah.
He had here. Yeah, I think it looks really good.
And give him another 3 or 4 months, and I think the central will be thicker. And so he's already decided he wants to extend his whiskers on down to the side, much like I have. And so we've got that planned coming up in the near future, and we'll update his progress as time passes. But in summary, beard and mustache hairs are transplantable, but they have a few unique problems. Hair diameter matching, not ripping up the hairs on extraction, and getting them to be placed in the proper angle. So if Wendy and I can help you, please give us a call. Thanks.